Thanks everybody for being here. Really excited for this conversation with Karina and Danielle about embodying transformation. And Kabir, if you could pin us up, please. That would be great. Thank you. Perfect. Thank you. So I'll give an introduction to myself, and then I'll have a time for both Karina and Danielle to introduce themselves before we hop into this conversation. So I'm Deborah Gardner. I'm a longtime educator. I first worked with high school students with learning differences for about 6 years. And then for the last 12 years, I've been in continuing education in psychotherapy, first at Sensory Motor Psychotherapy Institute as the director of education, and now as the head of education here at Beckley Academy. I'm really passionate about the neuroscience of learning, learning beyond cognition, and the parallels between learning and therapy. And I'm excited that we'll touch on some of these things today. So our title of our talk today is Embodying Transformation, Integrating the Psychedelic Assisted Therapy, Integrating PAT Experiences. So we'll be talking about how to help clients make meaning of their experiences and also transfer knowledge learned in non-ordinary consciousness into ordinary consciousness. I'm really excited to be here with Karina and Danielle today, two of our faculty. And before we begin, I'll give them some time to introduce themselves. And Karina, if you'd like to start, that would be fantastic.
Absolutely. Hello, Deb. Thank you. Hello, everyone. Thank you so much for joining us from wherever you are today. I'm coming to you from Los Angeles and taking a cue from my brilliant colleague, Danielle, I will start with talking about who I am in my everyday life before I talk about my professional life. I am a mother to 3 beautiful adult boys, a sister, a daughter, a partner and friend, and ultimately a student of life and of divinity, which really is the lens by which I look at the world and my days. In my professional life, I am a licensed psychotherapist, an educator, and clinical researcher here in Los Angeles. I have been providing psychotherapy for over 18 years here in LA in a variety of settings with a diverse population of patients and clients. And after about 13 years of providing just traditional talk therapy in private practice and in other settings, I began pursuing alternative therapeutic modalities, not only for the clients that I was serving, but for myself. I was really interested in what else there was out there. And I began an extensive therapeutic and spiritual training incorporating psychedelic medicine into the therapeutic process. So I completed a certificate in psychedelic assisted therapies and research from CIIS and MAPS in 2019. And since then have completed training specific to medicines like MDMA, and ketamine, psilocybin, LSD, and most recently, 5-MeO-DMT. I've also received training specific to internal family systems therapy and psychedelic psychotherapy, which I'm excited to incorporate into integration sessions and into my everyday talk therapy sessions as well. So I am currently, in my daily work, the director of psychedelic therapy training and DEI at Pacific Neuroscience Institute, where I train and supervise therapists delivering ketamine-assisted psychotherapy and as well as other psychedelic compounds in clinical trials. I'm also a research therapist facilitating psychedelic medicine and clinical trials myself. And I still maintain a private practice here in LA. I focus on treating depression and anxiety, codependency, intergenerational religious trauma. I also deliver ketamine-assisted psychotherapy and psychedelic integration sessions for my clients. So it's a pleasure to be here. Thanks, Deb.
Thanks, Karina. Danielle? Oh, you're muted, Danielle.
Thank you. Sorry about that. Hi, everyone. It's so good to see you on. Thank you for being here. Karina, every time you do an intro, I just fall more in love with you. So it's so great. Hi, everyone. My name is Danielle. Similarly, I'm a daughter. I'm a sister, a lover, a partner, an auntie. That's my favorite part. To my nephew, who's 5 years old, hopefully another along the way. I'm in Oakland, California, but I'm from LA. I'm a practitioner of the heart. A lot of my focus is on transmutation of that specific space. And I'm oriented towards constant practices of loving. And the way that that shows up is in my work. So currently I'm a ketamine-assisted psychotherapist and a regular talk psychotherapist in private practice. I do a lot of work on the full spectrum of drug use. So I see a lot of folks who are in more chaotic relationships with their drug use through doing harm reduction psychotherapy. Then on the other side of drug therapies for psychedelic therapy for like spiritual emergence. I'm super interested in working with folks who exist outside of, like, on the fringes of society or outside of the mainstream. So drug users, sex workers, radical, rebellious, kinky, queer, BDSM defined folks. I am a supervising clinician at Alchemy Community Therapy Center and a clinical consult there, as well as at CIIS. I'm MAPS trained for MDMA when that becomes legal, and a lot of the work I do is psychedelic integration. And yeah, it's been a joy to be a part of this community and learn from brilliant folks like Karina and work with Beckley. So we're glad to have you here.
Thank you, Danielle. Thanks to both of you. We're in store for a good conversation today, and you both bring a wealth of knowledge to this. So we'll start with talking about all of the things that come up in psychedelic experiences for clients. So there are complex and vast experiences that happen during medicine sessions. And I'd like to know, how do you help clients identify that salient material for transformation and integration and kind of sift through all of the nuances of experiences that happen? And Karina, maybe we'll start with you.
Thank you. I'd like to begin a discussion about psychedelic integration by recognizing that integration is as unique and varied as the individual themselves and their respective histories. And so another thing to consider here is that psychedelic integration is really a Western concept. So when we think about psychedelic work and non-ordinary states of consciousness, these have been present in indigenous cultures for millennia, since time immemorial. And there was already a framework for incorporating what emerged from these experiences into everyday life. There was a community that understood what was going on there and what might emerge, so that there was an incredible amount of support. So if we look at psychedelic integration from that lens, we realize that there is really no one way to approach this process, right? What we're actually doing is recognizing that something important and sacred has occurred between the individual and the medicine. And our job is to listen for what is emerging and support a person through that process, right? So how do we start is essentially the question. Like, how do we figure out where to begin in this process? And so what do? We realize that this person is now emerging into the world that they once knew, with brand new eyes and probably a brand new heart. And given that, I like to refer a person back to their intention. Why have they come to have this experience, right? We often ask a person, what brings you to the medicine experience? So I like to refer them back to that question. And I also like to refer back to the kind of the framework or the kind of protocol by which they came to the sessions. And so that might be a clinical trial. It might be ketamine-assisted psychotherapy, where we have a short period of time together. Or it might be a long-term talk therapy client where we have very specific goals. So I'm kind of referring back to those goals. But ultimately, this is a non-directive approach. So I'm working with whatever shows up first. I'm honoring that process. I'm honoring what's coming from a person's inner healing intelligence or their highest self or capital F self, in order to support a person through this, what can be a life-changing experience.
Thank you so much. And Danielle, so how are you helping clients identify those salient materials, right, to work with in transformation and integration?
Yeah, it's such a great question. I love Karina's answer, and it kind of moves me into my answer, which I'm thinking of like sort of the decolonial lens that Beckley teaches from, in the way in which I notice my clients wanting or needing to integrate material that basically like we get to expand into larger segments of their life. So for example, somebody comes to me for ketamine assisted therapy. A big thing that they're kind of saying a lot of typically in their intentions is that this isn't really working. My life isn't fully working. Something doesn't feel right. And ketamine's doing this thing where it's helping them expand into capital S self, highest self, right? And so then you're working with some of that material, and a lot of that material is metaphorical, symbolic. It's in the imaginal liminal spaces. It's more dreamlike material than it is like tangible, touchable. And you're giving meaning to that, a lot of meaning. You're reading into it. You're giving it validity. You're like qualifying it as its own entity. It's an animistic kind of relationship that you have with it. And you're allowing the client to have that expand into more space. And so I was just kind of seeing some clients when Karina was talking, who, you know, have these very normal jobs, work 40 hours a week, exist within capitalism and colonialism, right? Exist within like these like systems of oppression, and they're feeling like they want to take up more space in their lives. Maybe it's their spirit that wants to expand into those spaces. And we're sort of supporting that based off of client-centered, individually, what are those states of expansion that are sort of calling you specifically. And it looks different for every person, but that's kind of starting in the preparation phase of like, what are those sort of glimmers of hope for you? Like what kind of keeps you going? And then you're taking those from the very beginning and then integrating the preparation. Yeah.
Yeah. Thank you. And both of you sort of touched on how, you know, human beings are meaning makers, which goes well into our next set of prompts here, which is really about how we're working with the whole organization of experience and transformation. And so in Beckley's courses, we take a kind of bottom-up approach to that. We look at what's happening in the body, what's happening on an emotional level, and then what's happening with meaning and cognition. And so the first question here is, you know, what role does the body play in transformation and integration? And Karina, maybe we can start with you again.
Sure. The body, to your point, Deb, is part of the whole system, right? We are so used to, in our Western approach, thinking of the body and mind as if they're two separate things, when we know that they are exactly the same thing. They're part of the whole person. And because of that separation that we are encouraged to believe, a lot of times what happens is in a psychedelic medicine session, it really is the first time that the body has entered the therapy room. So a person may have been in therapy for a long time. They may have seen many doctors, physicians, been on several medications. This is the case right now in psychedelic medicine because we are often treating treatment-resistant disorders. And so people run the gamut of the Western medical system. And so what we do during preparation is we encourage a participant to feel into their body throughout the entirety of the process. We ask them to give themselves permission to allow the body to do what it needs to do. So I often ask a person or invite a person to get on the ground, be on the floor. We might set up a yoga mat or a cushion or a nest of pillows and let the body do whatever it needs to do. Oftentimes we will see trembling, we will see areas of the body that are shaking, moving, contorting. A lot of times the face and the jaw are involved. And so we're inviting that and we're saying, look, your body has this beautiful wisdom and intelligence. It's often letting go of a tremendous amount of stress or historical trauma. And let's invite that in. And as that process occurs during the medicine session, oftentimes a person realizes, oh my goodness, not only do I have a body, but my body has a tremendous amount of wisdom and intelligence. I mean, it has something to say. And so we use that experience to encourage a person throughout the integration process to continue listening. And there are a number of ways that we can do that.
Yeah, thank you. You really touched on how the wisdom of the body shows up and sort of gives you it's linked to inner healing intelligence, right? Danielle, how about you?
Yeah, great answer. I'll add one thing I typically just say to clients, which is that you can't get away with these moments of betrayal to your body. Your body knows. So, for example, if you're like, I'm actually kind of thirsty and I need some water, and you don't listen to that cue and go get yourself a glass of water, your body remembers that you did that, and the process of not trusting yourself is intensified. So, the reworking in therapy is really honoring every single subtle cue that occurs. And the therapist is supportive in the very beginning with sort of noticing those little cues as you get to know somebody. And then within the therapy session, you're working with all of those, like they're like micro expressions of somatic needs, and kind of intensifying them almost in an assumption that like those micro expressions have been like long ignored. And getting playful with it is something that I find myself doing in my sessions a lot when it comes to somatic work. And I'm just overjoyed that somatics is kind of taking over the talk therapy realm, just based off of how much we haven't been talking about the body. But like I'm just imagining client sessions where we've like danced, we've expanded, we've like shaped our bodies into the expression that matches the intention of a client. So for example, the one that's coming up is a client that really wanted to like take up more space. And then I think it was in her second ketamine session, starts opening up like a butterfly, right? She's doing this on the couch like this, but then we're like, make it bigger, like let's go in. And then she climbs onto the floor and she's just like unfolding and expanding and flying. And then I invite her to like go outside with me and feel into that as well, kind of when we have more access to motor skills at the end of the session. But we kind of like stayed with that shaping, and then the integration was in what other ways can you find that shape. And that's both in the somatic realm, but also in like the heart and also in the mind. Like how do you feel into this, the symbol language of that shape? Yeah, like that.
And you've really highlighted how movement, right, can be a bridge between what happens in non-ordinary consciousness into ordinary consciousness, which I appreciate. Let's talk about emotions now. So lots of emotions happen during psychedelic experiences, and they come up in integration, transformation, and integration as well. We know that grief also comes up in transformation. Anytime you have a transformation, you have a loss of something, an old pattern, an old habit, an old way of thinking. And how are you working with emotions? And helping clients sort of hold space for all those emotions that show up in integration. Let's start with Karina.
So this is the part where therapists, clinicians, and facilitators can rely on their breadth of knowledge, because we as clinicians know how to deal with emotion, right? We know how to compassionately and intelligently allow for a person's emotions to unfold. So I like to talk about psychedelic therapy work as grief work, because so often what is emerging in integration sessions is grief. We're recognizing our historical losses, and often the medicine is inviting us to be different in our lives and make significant changes into the future. And that requires a lot of change and ultimately, consequently, loss. So how are we approaching that grief process or the emotions that show up in the grief process? Well, we're doing that with curiosity and compassion, just like we would in any approach, right? And so we're bringing ourselves into that process, and we're modeling curiosity and compassion over and over and over again, so that the person can take back what I call the therapeutic voice, or that clinical voice, back into their regular life. There is, in my opinion, no greater healing modality or intervention than showing and teaching a person compassion for themselves and their psychological parts. So whatever is emerging, it is welcome here. Show me your pain, and I will show you a compassionate way to approach it. And I will invite you into that compassion into your everyday life, right? And so we're actually teaching people to be agents of compassionate care for themselves. And anytime we're hearing parts or voices that are critical of the process, or that are hesitant or resistant to approach this grief, we're being patient with it. And we're also approaching that with compassion, and we're listening for the wisdom of those protector parts. So I would say that ultimately it boils down to curiosity and compassion, really modeling the beauty of that.
Mm. Yeah.
Danielle.
It's just so good, Karina. That's really yummy. I'm agreeing. I think that this is the psychedelic assisted therapy wording is important. The fact that you're sitting with a clinician, like a psychotherapist or a psychologist, is pretty profound. And of course, there are other folks who have this skill, but working in that emotional realm with that compassion is really everything. And what I'm kind of playing with in my mind here is like the relational tether that happens between an individual and their own emotional experiences. And I almost see the emotions as really going back to Rumi's poem called Guest House. So this being human is a guest house. I always think of it as like classic therapy poem, but that each emotion is a guest and we get to invite them in for a cup of tea, and you get curious about them, and you're working with a client in a relational tether to them as they're in a relational tether to you, to themselves, to their internal divine, to each emotion, and you're just strengthening those bonds. And I almost imagine these tethers as being like glowing, vibrant, like highways, and you're sort of like it's strengthening that, and allowing them to be in relationship to each emotion, with that compassion, as Karina said, with that curiosity, with the sort of in reverence to each thing that visits, as if it has a message, or as if it knows exactly what it's doing. The inner healing intelligence is a huge concept that we really utilize here, of your body knows exactly what to do. So it's interesting, we talk about the somatic pieces and then we move into the emotion, but that ultimately, what a brilliant design we are. And if we can hold a container where we're like, what do we need to trust the brilliant design, and contain and work with the like have a ritualized container in which all of that can happen. And that's the work we're doing. And it's a total enigma. And yeah, therapy is so hard to describe.
I love that. And one of the things that we've been threading through these webinars is how therapists are taking care of themselves during these moments. Because, there's so much happening in the intersubjective field during this, all this work with emotions. How are you as therapists taking care of yourself in those moments?
Yeah.
Whoever would like to go first. Yeah.
I'll go ahead and start there since I was just talking. Yeah, I think we talked about this in a couple other webinars too, but that it becomes everything. Karina and I have talked about it's just made us even more disciplined and more like how much space it's taken up to really like prioritize our own spiritual practices. And what I noticed within session is a lot of like, the same thing I was saying about the like betrayal within the body. And you can notice that when I feel an emotion that's sort of being transferred to me, in the territorial phenomenon of like what is going on with the client, and I feel it, and my heart will break for a moment, and I'm like, ooh, I have to tend to you later. Right now I'm holding, or I'm with the client, and that I'll tell them like, this is what's happening for me, for you, for us. And then if I still feel that tension, like I'm doing a lot of cleansing work. I do like a combination of Florida water and camphor after each client, to sort of like wash away this. It's like a spiritual bleach ultimately of each person. And then my rituals of like bathing and prayer and ceremony to show up for, both in gratitude to all the material that they are giving me the honor to work with, but also to like support their transmutation. And yeah, I'm actually just going to give a quick example. Is that, I had a client just this week who is entering sort of a little bit of a dangerous manic territory. And I was like feeling the weight of my concern for her. And So my partner, who's a ceremonial magician, and I worked together to do like a prayer and a candle, and like dressed a candle for her and wrote her name in it. And like it just like sitting with that in ceremony of like, this is how we show up energetically for like what we're feeling and also in honoring. So just examples.
Thank you. And Karina?
Thank you, Danielle. It's so beautiful to listen to and kind of even witness the way that you take this. So, you take this work to heart and you take it seriously. And it's one of the reasons I admire you so much. You mentioned before that, we can't get away with much in terms of the body in this work. And I like to think about that concept in general when it comes to psychotherapy or dealing with other people. I have never in my career seen anybody get away with anything. And I think that's really important to consider, especially when we're working in the sense that with sensitive states where a participant is extremely vulnerable and suggestible. So there is an extremely high bar for the facilitator in these sessions to take care of themselves, because we will not get away with doing this work for very long if we are not caring for ourselves properly. And so we have to really think outside of the box. And the way that we can do that is by listening for what we're suggesting that the participant do. So if we're suggesting that the participant is taking care of their heart, taking care of their body, taking care of their relationships, then we better be doing that too. Because at the point at which we have stopped or there is an obstacle in our self-care, we will not be able to care for a participant past that point. And that's just the truth. We can fool ourselves into thinking that we can, but we can't. And so we could talk all day about self-care for facilitators, but I think it's very important that we have our own kind of ritualistic or ceremonial practice at the end of each day, where we are ridding ourselves and cleansing ourselves and disconnecting from that which we encountered in a very loving way. But also, most importantly, that we have a community of like-minded practitioners, people inside and outside of this space that we can turn to for love and support and care. Reminding everybody here that this work happened in Indigenous communities for millennia before it came to us. And there was a framework by which the medicine people, shamans, or folks who are working with medicine or non-ordinary states of consciousness operated. So we need to have a similar framework for ourselves.
Yeah, and you have both really highlighted, the importance of, so in our courses as pillars, we have self-study and also community really as being significant, and you've really touched on why that matters for ethical practice. So moving on to meaning making and cognition now. One way to think about meaning making in integration is sort of like language provides a shortcut, right, or a cue for a body state, right, or a emotional state that sort of was learned through psychedelic experiences. How are you helping clients, one, not make meaning too quickly of those experiences, and make meaning that's really going to serve them in their daily lives? And whoever would like to go first.
It's such a big topic to like answer in a short little blurb, but so I'm just gonna give examples. Okay, so for example, I had a ketamine client just yesterday who had beautiful imagery show up. Typically, always like these blossoming flowers, and we led her through an inner child meditation. And sort of dropped her into a space in which that was material she was working with. And she had this image of her, she saw her own inner child, but then she saw her mother's inner child. And there was a lot of abuse and harm that happened in that dynamic with her mother. And when she saw her mother's inner child, she felt like a vacuum. She was getting sucked into her mom's child. And it was like, and she like was like really drawn to wanting to like enter that space. And then she felt a river, it's like a red river that came and like almost like grabbed her back away. It felt like strength. And she said she felt in her body in the session, she's like, my spine like went like this. Like I felt like I was suddenly strong. And so we have this dream image, and we could just be like, wow, that's crazy. It's just like a dream. Oh my God, how wild. That's cool. And then move on to something else. Or we can make the entire session about that and integration, which is what we did. Those like few seconds. And what we worked with was, you know, I mean, obviously all the inner child work, but we actually paid a lot of attention to that river. And who did that? Who is that? Ancestors, guides, protectors? Who are they? What do they look like? What are their names? Like, how do we honor them? How do we put them on the altar? Like, what is going to, how do we like invite them into? And then we worked with this image of like, okay, so we have the past, we have mom's inner child. How do we create the future? So there's 7 generations before, and then there's 7 generations after. And how do we create this like future pile? It's so funny to play with the like just future funnel of like, this is where your energy can go. And how do we guide you here if you want to, if you're wanting to love, you're wanting to care for the child is here and she's doing family planning. So that's my example, I suppose, to kind of speak to why meaning making, beliefs, cognition. I hope there's something in there.
Yeah, thank you. And Karina?
Yes, Danielle, exactly. So what we're doing, we're inviting the participant over and over again into the imagery, into the feeling, into the visuals that are showing up in these experiences, right? So exactly what Danielle said, we could listen to these complex and beautiful, sometimes frightening and terrifying images that show up, or experiences that show up and go, oh, interesting. Or we can invite the participant back there over and over again, recognizing that it is not our role to decipher or make meaning there. It really is the participant's privilege and opportunity. And so what are we doing? We are doing what the opposite of what is often happening in regular life, where people are encouraged or invited to forget, to repress, to suppress, to turn away from their internal experience. And we're inviting them back into that internal experience again and again and again. And we're saying, how can we develop relationship with what is emerging from these experiences, right? So we're encouraging people a lot of times to create ritual, to create practice, to create a time to dialogue, or to feel into these experiences over and over again until the meaning is emerging organically from the participant.
Yeah, thank you both so much. And you touched a little bit, Karina, on sort of more difficult things that can show up in transformation. I would love to hear each of you share an example where you've supported a client through an integration that's particularly challenging. They had a challenging medicine session, or maybe perhaps challenging things emerged in integration. And Karina, maybe we'll start with you.
Yeah, I will say that having done this work for a few years now, I have had the privilege of helping people through very difficult experiences. Two come to mind that most facilitators, if they're working in this space for long enough, will probably encounter. The first was a female participant in a clinical trial for psilocybin and alcohol use disorder. Who let us know that she had endured horrendous childhood trauma. And sure enough, during her second medicine session, that trauma was relived. And we were prepared because we asked the right questions during preparation and intake. And we had walked the participant through what we were available to do and how we would support her through that process. And we followed through with that. So already the corrective experience was occurring. So in integration, what we did was we talked about what it was like to have that experience, and we did some trauma-informed integrative work, right? So we listened. We allowed her to re-experience that trauma in the way that felt safe and right to her. So we didn't encourage her to go any further than she was willing to, or step away or avoid. We were there and we offered support, we offered compassion, we were human with her, and reflected back all of the feelings that we had clinically and otherwise, and try to create and support that corrective experience for her, helping her give herself permission to be compassionate with herself, and encouraging her to create any change that she wanted to moving forward. There's a lot more there, but that's generally what happened. The second participant that I'm thinking about is a person who was nearing end of life. And she had a terminal illness and came for ketamine-assisted psychotherapy as an ancillary approach to her palliative care. And in that experience, again, we had a general intention for the work, but what I found was really showing up as a human being and being willing to listen and feel all of the feelings that were involved with a person coming to terms with her end of life. So what did integration look like for her? It looked like holding a tremendous amount of pain while admitting how painful this process can be, and helping her come to terms with that while developing a support system for that process, right? So what am I saying here? I'm saying that as we are trained and prepared to help people with their respective issues, these psychedelic medicine experiences and the relationships that we develop during those experiences can be corrective and at some points curative as well.
Yeah, thank you so much. I'm so glad you highlighted the significance of the therapeutic relationship, particularly for providing that missing experience. And Danielle, how about you?
Yeah, I'm really liking the languaging that Karina is using here of like providing a corrective experience, that being trauma informed. And what's coming up is that like how important it is for clinicians to have the capacity to tolerate the extremes, and prevent those ruptures in which that emergence occurs again of re-experiencing of a traumatic event, and it is not held in a way that is supportive, and becomes like a truly re-experienced trauma, or the client receives a messaging that they've done too much, or they're a problem, or it's not okay. So it really connects to like how much we have to take care of ourselves so that we can have the capacity, go to our own therapy, really continue to expand capacity to tolerate. Example for me that comes up in particularly challenging medicine session is a client of mine who is a mother of 3, and she had a lot of like suicidal ideation, treatment-resistant depression, really wanted to die. And in her ketamine session, that was what came up, where she was just like, I really do, Danielle. And I'm like, I know. And then we're working with that for like 2 sessions. It's terrifying, right? Between sessions, you're like, I'm really holding the reality here that like something could happen. Then in her highest dose session, she feels like she's dying. And that's what's happening in the room with me. She's like, is it go? I'm really scared right now. And I'm like, I know you are. And she's like, can you hold my hand? I'm holding her hand. And she's like, I think it's happening. And I'm like, okay, this is like, we have an agreement before sessions at the beginning of therapy. It's like, if the door enters and you see that light, you will not go, you're not going. And so we're reminding her in that moment, do you remember our agreement? And she's like, I remember. And I'm like, okay, so you're going to feel like you're dying and you're not going to do it. And it's so intense. We're like both crying. And then she gets to this point where she really feels like she is. And she goes, I don't want to. I want to stay here. Make me come back. And I'm like, okay, let's come back. And she's like, I want to come back. Where's my body? And then we're like grounding her, bringing her back into the room, reminding her of all her tethers. So it's her kids. And we're saying her kids' names like they're mantras, And then she's like, I don't want to go. And that was the point of all of it. And all of her integration has been in that sense It's just that she doesn't want to go. She felt something similar to that. And she's like, wait, no, that's not it. I want to be here. Right? I want to be here. I don't want to go. So intense. So
Okay.
I hope that answered the question. Yeah.
Yeah, such a powerful example, but all the examples you shared. Before we head to questions, any final tips for clinicians who, want to provide successful integration? And then we'll move on to questions. We can take questions either raising your hand or you can type them in the chat, whichever feels good.
Yeah, so this is obviously a topic that we could talk about for hours and hours. But I think something that we haven't touched on today that's important to consider is the importance of collaborative care and community relationships. So a lot of what emerges in medicine sessions can certainly be approached during integration. And we also have to recognize that we all are compelled to operate within our scope of practice. And so a lot of times, because medicine experiences are calling for participants to make significant change in their life, we may have to refer to the appropriate professionals outside of our clinic space. And so that those might be other clinicians like family therapists or couples therapists that can help with, some of the material that emerged there, or physical therapists, somatic therapists, personal trainers, hypnotherapists, support groups. And so this all speaks to the importance of having a community network of people who understand what psychedelic therapy is. And that's why it's so important that there are people and professionals coming to this work from all walks and all approaches. We really need an entire network, and what I like to say is an army of people who are ready to do this work and collaborate with one another.
Beautiful.
Yeah. Just underline it, consultation, underlined a million times, is you should not be holding anybody alone. And like Karina's saying, it could be other clinicians. I'm in multiple consultation groups with other psychedelic therapists, but also like working with folks who understand like the neuroscience, the drugs, the interactions, psychiatrists, doctors. Yeah, you're not in it alone.
Love it. Thank you both so much for everything that you've shared. We'll take questions now. Feel free to pop them in the chat. We have about 10, maybe a little more minutes for questions. You can also raise your hand, and we have one here. What's the composition of your treatment team during a session? Maybe we'll start with you, Karina.
So it really depends on the nature of the program. With ketamine-assisted I should say with any medicine session, there's always a physician on board, at least one physician who is overseeing the case. And depending on whether this is a clinical trial or ketamine therapy, the participant may need to come off or titrate off of their medication, depending on the protocol. So there's always going to be a physician, and we want to make sure that that physician is psychedelic trained and informed, so that they know what they're doing and how to approach the participant. There is typically another therapist in the room during these sessions. However, in ketamine-assisted psychotherapy, it's not unusual that you're working one-on-one with a patient or a client. So there's a physician, there's at least one therapist, if not two. Our team also has a social worker and other kind of ancillary staff to which we can refer. And again, we're also making sure that we have a community network to which we can refer if necessary.
Thank you. Danielle, anything to add? Anything different from your end?
Nope.
Great. Any other questions? Feel free to pop them in the chat or raise your hand. I have a question while we're waiting. So we don't always have the luxury of time for integration. When you don't have all the time you need or sort of the ideal time, how are you helping clients maximize what time they do have in integration?
A lot of the ways in which I'll describe therapy is it doesn't just work within session. It's not like 50 minutes a week is going to be where you're doing all your healing. It's activating all the time that surrounds it. So integration is specifically that too, where you're I mean, at least one of the things I'm doing a lot is like kind of giving homework, of like, let's pay attention to what occurs outside of this ritualized space that we have. And like being intentional about that, like showing up for everything that we talked about in session, paying attention to it. So, quick answer.
What about you, Karina?
Yeah, it's a similar approach to Danielle. What we're really inviting people to do is develop a relationship with the material that's emerging outside of the 60 or 90-minute integration session. And that's very different than a traditional Western approach to healing, right? We're often encouraged to like take a pill or do a program and you're going to be fine after that. And so what we're really doing is we're modeling and encouraging a person to recognize this is probably going to be a lifelong process. And so we're going to have the time that we have together, and we're going to try to maximize that time, right, by inviting you back into the material and developing a relationship with it. But at the same time, we're going to let the process unfold organically. And you'll find that as that process unfolds, you'll kind of figure out what support you need in the next step. And we'll be here to maybe point you in the right direction, but we encourage you to partner with other people, places, and things that feel right for the place you are in your healing or evolution.
Thank you. I'll come up with another question if we don't have any. So do you think that a therapist can successfully provide effective integration therapy if they weren't there for preparation or the experience?
I certainly do. And I think it's really important that that's why I think it's important that so many professionals are trained in this work and informed. My personal belief is that clinicians outside of the psychedelic space need to recognize that they are about to be hit with a tidal wave of clients and patients who are either dabbling, experimenting, or going through formal psychedelic assisted therapy. And so they're going to be delivered back to their regular treatment teams in one way or another. So the way that I would handle it, if I wasn't part of preparation or medicine sessions, is I would ask the participant, what would you like? What kind of support would you like? How may I support you? And how much, progress have you made so far? I'd be happy to kind of take the baton and continue on with this work. But ideally, I would have access to the original treatment team. So I would love to speak to the therapists, the facilitators, the physicians. I would like to know, obviously, what type of medicine experiences they had and how many. And then we can kind of move forward with the exploration and integration process.
Yeah, thank you. We have a question here. Are there any books generally good for clients to read that help with integration or podcasts?
I would say no material ultimately replaces the actual like one-on-one work within integration, but there are some that I tend to go to. We were bringing up grief earlier, and the book The Wild Edge of Sorrow by Frances Weller just showed up. It's a really good one for just general grief work and therefore integration. And then a podcast I'm finding myself recommend a lot are twofold. One is The Emerald, and the other is Holistic Life Navigation. And you should vet those before you actually just recommend them and just get a sense of the quality and what you would use those for. And I'm sure there are more books. Yeah.
And sure, I'll through something from MAPS, it looks like, in chat as well.
Mm-hmm.
Karina, anything else come to mind for you?
There are, it really depends on the individual and their particular approach. The Psychedelic Handbook is one that's pretty dense, but kind of goes through the entire history of psychedelics. Psychedelic integration, I used to have it here, but it's just a beautiful and complex book. Some people don't like that level of complexity and content. I'm one of those people that really likes to simplify integration. And so I honestly recommend just starting with the journal. Let's just start with you and what's showing up, and then working directly with the material that's emerging from there.
Right. Quick note, I was just say like go to the aspects of the integration. So like, for example, I find myself recommending like more of like a client is like, oh, I started pulling some tarot cards about my session. Great. Now we're going to get you a new tarot deck and you're going to get a tarot book. So we're going to support integration through whatever like little river they're specifically being called to. If it's somatic work, then we're like, okay, or martial arts, then we're like, okay, how can we get you more into martial arts? We're just sort of following that thread.
Yeah. Well, we are at time. So thank you both so much for this conversation. You two are very inspiring every time we talk. So thank you.